Silk, smooth incision lenticular keratomelusis, is the latest minimally invasive laser vision correction treatment from Johnson & Johnson Vision that reshapes the cornea to correct a patient's refractive error, such as nearsightedness, with and without astigmatism. For the Silk treatment, the surgeon will take detailed measurements of the patient's eye, which are used to program the Elita femtosecond laser for the procedure. The laser will then create a small, precise, lens-shaped disc of corneal tissue called a lenticule within a specific depth of the cornea. Before the treatment, the patient's eye is numbed with eye drops. Once comfortable, the surgeon will place a soft suction ring on the patient's eye to help keep the eye in the correct position while the lenticule is created. First, the Elita laser uses tiny, ultra-precise pulses of laser light to create the lower interface of the intrastromal lenticule by moving a raster scan line in a radial pattern. Then, the laser creates a ring resection that defines the edges of the lenticule and creates the upper interface of the intrastromal lenticule. Once the intrastromal lenticule is created, the laser will create a small arc-shaped incision approximately 3 millimeters long on the surface of the cornea, giving the surgeon easy access to the lenticule. Finally, the patient is moved under a surgical microscope, where the surgeon will gently confirm the lenticule separation and then remove the lenticule from the cornea with a special instrument. The removal of the intrastromal lenticule changes the shape of the cornea and the way light bends into the eye, correcting the patient's vision.